One of the main causes of shortages and poor distribution of health workers is a lack of numbers of health professionals. In some cases, there are even inadequate numbers of persons with appropriate education and training entering the labor market. Monitoring and evaluation are key components of change implementation, but making them effective is always a challenge.
We see the importance of the Department of Health doing the monitoring and evaluation because we want to see the balance between the service needs and the type of health workers that are produced through our own educational system.
Coisa é o monitoramento, é o processo de acompanhamento sistemático e continuado de um determinado programa, do conjunto de ações que estão propostas para aquele programa. Nesse sentido, uma questão que é fundamental é você conseguir desenhar direito o programa para saber quais etapas que precisam ser acompanhadas. Com muita frequência, a gente, principalmente na área pública, lança os programas, cria os programas, né? Implementa e depois vai desenvolver processos de acompanhamento e avaliação, quando o processo já está em andamento, né? Então é importante, para que o processo dê certo, você conseguir delimitar claramente as diferentes etapas e fases de implantação do projeto ou do programa que você quer alcançar.
Mechanisms need to be in place to track the changes and progress so that policymakers can be informed in good time if their policies need adapting. To that end, valid and updated information is needed in an easily accessible and interpretable format.
In the Philippines right now, because of our regular monitoring visits conducted by the Professional Regulation Board and the Professional Regulations Commission with the Commission on Higher Education, CHED, they have visited almost all the 38 medical schools in the country, and they have focused on those schools that are not performing well in the licensure examinations. And this is very important because it will ensure that all the medical schools will comply with the minimum requirements required by the Commission on Higher Education.
Many low and middle-income countries do not have data available on the health workforce for use by ministries of health and education, nor the capacity to utilize this data to inform health workforce strategies. Effective monitoring requires information systems that produce relevant and reliable data in a timely and easily accessible manner. In most countries, basic health workforce data, including those relating to the process of being educated, are deficient.
Not many countries are collecting data. Most of the countries have a very poor information system in this area. The case of Brazil is an exception in some way. You have probably around 40 countries among the 200 that have an information system that are able to collect the data in training, education, and to make better use of this information.
Eu falava há pouco tempo atrás da gestão baseada em padrões de desempenho. Nós instruímos estes padrões de desempenho e estamos a avaliar 6 áreas. Estamos a avaliar a instrução na sala de aula, que visa exatamente sermos capazes de monitorar aquilo que o docente faz a nível da sala de aula, o que é que está a dar, qual é o objetivo, qual é a finalidade e sermos capazes de avaliar se de facto os objetivos da formação estão a ser atingidos. Avaliamos também os estágios. Esta parte dos estágios práticos ou pré-clínicos são essenciais na formação nas áreas técnico-profissionais e particularmente na área de saúde, porque é importante que o técnico que nós graduamos seja capaz de saber fazer e não somente ser capaz de conhecer, ter o conhecimento, mas ser capaz de fazer e fazer bem. porque em saúde não existe meio profissional, ou sabe ou não sabe fazer. Então, esta questão do estágio clínico e acompanhamento a nível dos estágios clínicos é fundamental para que nós podemos ter a certeza de que no final da formação este técnico sabe fazer e sabe fazer bem. A outra questão, a outra área que nós avaliamos é a gestão na instituição de formação. Falamos particularmente dos materiais de ensino, porque não basta somente ter uma instituição de formação, ter um bom estágio, mas para que isto aconteça é necessário que os instrumentos de formação estejam na instituição. Avaliamos também a área de higiene e limpeza. Avaliamos também a área administrativa e financeira da instituição de formação. Portanto, estas áreas, como pode perceber, são as áreas essenciais, é o corpo da instituição de formação e visa, de facto, garantir que no final nós tenhamos os profissionais devidamente qualificados.
A high level of collaboration between key stakeholders is needed to reach agreement on the data to be collected, the definition of indicators, and on the sharing of the resulting information. An example is a health workforce observatory in Brazil.
Health Workforce Observatory network that started in Brazil at the late 90s was an experience that did so well in monitoring the trends in health workforce that was taken by WHO globally and was implemented. It's a mechanism, a collective mechanism, or I think it's better to say it's inter-institutional mechanism led by one institution, normally the Ministry of Health, that helps the different institutions in the area to collect data, to analyze the data on health workforce. So making possible to identify what the trends what the different problems priorities that need to be addressed by the different partners.
Monitoring and evaluation is not an end in itself. There is little value in producing information that will not be used. It is, therefore, critical that policymakers and implementers of change identify their information needs. There is no need to monitor everything and thereby accumulate data that will be left unused. A major challenge is to bring the information to those who can best use it for policy and decision-making purposes and to ensure that it is properly interpreted and used. Good Practice Recommendation 1. Government at the highest level shows political commitment to reform and takes leadership of its implementation. Good Practice Recommendation 2. There is formal collaboration and shared accountability between the Ministry of Health, the Ministry of Education, and other related ministries, for example, finance, labor, public service, at a national and/or sub-national level in the education and training of health professionals. Good Practice Recommendation 3. A national plan to produce and retain graduates is developed in consultation with stakeholders informed by the needs and absorptive capacity of the labor market and aligned with the National Health Plan. Good Practice Recommendation 4. The creation or strengthening of national or subnational institutions, capacities, or mechanisms to support the implementation of reform and scale-up plan, for example, legislation, policies, procedures.